Hey guys, Dr. Andrew here from Chiro Chiropractic Wellness Center, and welcome to today's episode of the Chiropractic Couch. Now, did you know that 2 to 3% of the world's population have scoliosis? Now, this occurs during early infancy or early childhood, around about puberty, and occurs equally between both genders. Now, scoliosis is progressive curvature to the spine, which means that it's an either left or right-hand curve causing problems with your muscles, your nerves, and your discs. Now, when you look at from the side, your spine should have normal curves like this, but when you look front on, it should be perfectly straight. Now, when there's a 10-degree curve sideways, we call this a scoliosis. Now, there are many warning signs that indicate that you might have a scoliosis. So if you notice that these of any signs I'm about to tell you, please get a trained clinician to assess you for scoliosis. Now, each different scoliosis has different types of treatment. That's why it's so important to get seen by a specialist. So here's what I want you to do to keep an eye out. If somebody leans forward and there is a humping of the spine sideways, that's called an Adams test. You might have uneven shoulders or hips. There might be a family history. You might get muscle bulking on the side of the spine, and you might get pain. Now, having an accurate assessment to diagnose it, for example, will give you the best outcome. It's detected through a posture analysis, but most importantly, it's detected through x-rays. Now, a standing x-ray will be able to determine the true degree of the alignment of the curves and whether it's likely to progress. It'll work out whether there's more lateral or more rotational components and if it's correctable or not. And yes, of course, this will allow better treatment for it as well. But there's no scientifically proven exercise therapy that will reduce the scoliosis. You need an all-round approach from a clinical care and at-home care. If you don't, it is likely to progress. Now, there are lots of false claims out there saying that you can stretch or do yoga or have massage to help scoliosis. There are 4 things that actually help scoliosis. First thing is manual therapy like chiro or physio. The aim is to diagnose it, give you correct treatment, improve your spine, pain and function, and of course get those muscles working. You can do rehab exercises like CBP, Scoli Roll, Scoli Balance, Growth C's methods. You might have bracing for the larger curves, and of course there is surgery for those severe progressing curves. Now, here in our office, we use chiropractic biophysics, which has been proven over many years to reduce the pain of your spinal curves, and we use a combination of adjustments, rehab exercises, and traction. Now, this helps your spine's flexibility for better management of the scoliosis, and it's very highly researched and proven to be extremely effective in certain cases. Now, in fact, tomorrow I'm actually going to a seminar to be part of my continual professional development. You see, it's such a specialized area, and it requires so much more education than a regular person, and we need constant ways to possibly improve and treat people's scoliosis, which is why it's vital, that you need to see somebody who's qualified and specialized in this area. Now, on a regular basis, I see people with scoliosis that could have prevented it. So the most common thing I recommend is you get it seen early. Otherwise, your nervous system will stop working, and when your nervous system stops working, you stop working, and your overall health will be worse as a result. Now, unfortunately, gravity means that scoliosis can cause you to have a higher risk of arthritis, degeneration in the future. So prevention is better than cure. And if you know someone with scoliosis, make sure you get them checked by me or somebody else to make sure that problem or the pain doesn't get worse or the problem gets worse. So that's a quick insight to scoliosis. If you want to see a picture of a scoliosis, give me a message and I'll show you that. Or if you want an assessment for scoliosis, please let me know and I'll have a look at your spine. So my name's Dr. Andrew from Chiro Chiropractic Wellness Center, and I'll see you next week on the Chiro Couch. Bye for now.